Hi everyone, today we are going to discuss about Tourette syndrome. It is a neurobehavioral disorder which is characterized by tics. Tics are unintentional, fast and repetitive, either muscle movements or vocalizing sounds. So this Tourette syndrome is characterized by multiple motor tics as well as phonic tics. These patients can voluntarily suppress tics for short periods of time, but then they experience an irresistible urge to express them. Associated behavioral disturbances include anxiety, depression, ADHD, that is attention deficit hyperactivity disorder, and OCD, obsessive compulsive disorder. One of the proposed mechanisms for tics is excessive dopamine in the striatum, which excites thalamocortical circuits, which produces tics. That's why we use anti-dopaminergic agents in the treatment of Tourette syndrome. Coming to clinical features, basically this disorder is a complex disorder. Initially, 80% of the patients will have only motor tics. 20% of the patients initially have phonic tics. And finally, after some days, both motor tics and phonic tics are there in all patients. This disorder is more common in males than females, and this disease also have genetic predisposition. There are 4 genes associated with the Tourette syndrome. They are WWC1, CELSR3, NIPBL, FN1. Coming to examples of motor tics, face, head, and shoulder are the most commonly involved areas. So, for example, sniffing, blinking, frowning, shoulder shrugging, and head thrusting, etc. These are the motor. This comes under motor tics. Next, coming to vocal tics, that is phonic tics. So, patients will do some grunts, barking, hisses, and throat clearing. This will be done unintentionally and repetitively. So, there are 4 important terms to understand the disease well. So these patients will have sometimes verbal utterances. These include coprolalia, echolalia, and palilalia. So one odd thing here is echopraxia. So echopraxia is related to movement, and coprolalia, echolalia, and palilalia. This lalia is related to verbal. So what is echopraxia? In this, patient imitates others' movements. So other person's movement will be imitated by this patient. Coming to coprolalia. So in this, patient will do some upspin speech. In echolalia, he will imitate other speech. Coming to palilalia, he will repetition of words or phrases will be there. So to diagnose, symptoms begin less than 18 years of age and cause social or occupational impairment. Multiple motor tics should be present. One or more vocal tics must be present, and more than 1 year of duration of these symptoms should be there. So then only we can consider this as a Tourette syndrome. And this differentiates Tourette syndrome from persistent motor or vocal tic disorder or professional tic disorder. So next, going to treatment part. So here, behavioral therapy is the best initial treatment, in which habit reversal therapy is most effective. Only if behavioral therapy fails or tics are severe or disabling only, we should go to pharmacological management. Why? Because in a higher proportion of patients, the severity of tics decreased in adult life, becoming less of a medical problem. So we should conservatively manage the patient during first decades of life. Most clinicians start these patients on alpha agonists that are clonidine and guanfacine. Though these drugs are less effective at tic reduction, the side effects of these drugs are very much less when compared to anti-dopaminergic agents. These drugs also have the advantage of improving the symptoms of concomitant ADHD. Coming to anti-dopaminergic drugs, there are 2 classes here, dopamine depleting agents and dopamine blocking agents. So dopamine depleting agent is tetrabenazine, which is a VMAT2 inhibitor, which results in decreased uptake of monoamines. So it is preferred over dopamine blocking agents because less risk of tardive dyskinesia. If these drugs do not give any beneficial response, we should start the patient on risperidone, which is an atypical antipsychotic, which also helps in improving the symptoms of comorbid OCT. So we may try this drug before typical antipsychotics. So even this drug is not working, we should directly go on to haloperidol, which is a typical antipsychotic. So the other antipsychotics are flufenazine and pimozide. So there is the side effects are significant weight gain and tardive dyskinesia and other long-term potentially irreversible motor side effects. We also can use injection of botulinum toxin type A at the site of the most distressing tics. And also deep brain stimulation is one of the options. The symptoms sometimes overlap with Wilson's disease, so it should be excluded. This is everything you need to know about Tourette syndrome. Thank you for watching. Please subscribe if you like the video.